Hi guys, it's Trev, body mechanic from Absolute Fitness. So, video today is all about how I actually treat clients. Previous videos have all been showing people or potential students how to learn sports massage to pass a test. But just like driving, we learn to drive to pass the test and then we learn to drive. So my video is all about how I go about actually treating a real life client. Now real life clients are quite hard to come by to allow you to video. So the gentleman you're about to meet, he is somebody that's known to me. I've treated him quite a few times before because of his job and his lifestyle and things, and we'll go into that in a bit more detail when he's here. But I haven't seen him now for over a year. So I'm going to obviously see how he presents when he comes in. The idea is I'm going to show you exactly how I go about treating him and putting him right. That's the purpose of this video. Okay, so everything I do, all the techniques I do, they're all techniques that you've learned as a budding sports masseuse, but there's an element of remedial element in this. So I'll be using some of my tools, some thumpers and equipment that I've bought, and like I say, some of my tools that I've made to treat him. All right, I'm going to talk it all the way through what I'm doing, etc., so you can see clearly what I'm doing. However, what I'm going to say is it's not a definitive treatment, okay, what you see, because it's specific for him and him only. You've got to base every client individually so that you know how, what treatment's going to be relevant for them. Okay, so we'll get the client in. I'll have already done the interview part, the declarations, the medical questions, but you won't see any of that because obviously that's data protection. And then we'll go straight on to the postural assessment, etc. Okay? Right then, so I'm with Steve now. This is my client who I've previously mentioned. So Steve, first things first, you are actually consenting to this going onto YouTube, aren't you?
I am, yes.
Fantastic. Right. So a little bit about Steve's lifestyle before we go into postural assessment and some range of motion tests, some special tests, all to try and diagnose exactly what's going on with his back. So, lifestyle, works for the NHS, he fixes all the computer systems, so he travels around all the different centres, all the doctor's surgeries and things, maintaining the equipment, so that involves him basically getting under tables, rerouting cables potentially, being sat, sorting out printer systems, etc, etc. Then he's obviously driving from one place to another, so there's a lot of flexion based lifestyle going on in his job. Then when he goes home, obviously he likes to chill, relax, watch a little bit of telly, but his other favourite thing is playing games. And as we know, another flexion biased lifestyle. So it's all creating a picture straight away in my head of what the potential problems could be for Steve. So at the moment, Steve, how's your back?
It hurts, it's achy. I'm stiff, the range of motion's not what it was. I'm getting a lot of pain down my leg.
Okay.
So from the small of my back down my leg.
Okay, fantastic. So prior to coming on to you now, we've done the interview part, so his medical history, etc., his personal details, which obviously I can't share for data protection reasons. So what we're going to do now is I'm going to go into the actual postural assessment first, and then we'll roll on from there, exactly how I would deal with somebody. I am going to show you initially a slump test, because somebody coming in with a bad back, that would be my first protocol. Make sure it's not a prolapse disc to start with. Okay, so that's where I will start with, and then I'll go to the postural assessment. Alright? Right, so we're now going to look at a slump test. So Steve, keep your chin on your chest, and I want you to slump your upper back as well. That's it. Now then, can you straighten out your left leg for me? Does that generate pain or just tightness?
A lot of tightness, no pain.
Tightness, no pain, no. Okay, let that come down. This time, can you do the same on your right leg? generate pain or tightness?
Tightness.
Tightness, okay, let that go down. Right, this time I'm just going to put a little bit of pressure on the back of your head. Can you straighten that left leg again? Pain or tightness?
Just tightness, yeah.
Okay, let that down, and then do the same for me on this leg. Pain or tightness?
Just tight.
Great stuff. So that would indicate that you haven't got a prolapse disc. Okay. If I'd got a positive that had generated pain, what I'd then do with you is I would take you onto the bed and I'd do a lie and leg raise just to confirm it. Okay. But that's good. So we're going to stop on that one now. So I'm going to bring you off the bed. Okay. So Steve, just stand as natural as you can for me. All right. So we're going to start at the bottom and work our way up. So as I'm looking at Steve at the moment, I can clearly see he's carrying his weight on his left leg. If you notice the position of the feet to the floor, the right leg is standing outside his base of shoulder down. It's just creeping out so it's sticking out from his hip, whereas his left leg is directly underneath his hip. Both feet are very slightly turned out, so there could be a little bit of tightness there in his piriformis muscle, but other than that, not too bad. I was kind of having a little look up from can't really see a great deal going on there. That's a good man, Steve, thank you. As we come up, okay, yeah. So you can let them relax now, let their arms hang down and relax. So as I come up, Steve, now, as we can see clearly now, we can see the palms of those hands, more so the left one, because the right shoulder is being pulled further round more than the left. All right, so he's leading with the right shoulder. Doesn't seem to be a twist. We're just having a quick look at that spine. That all seems not too bad. Maybe he's kinking ever so slightly to the left. But nothing major to write home about. But definitely tight across the front of the chest, probably definitely tight in the lats. The reason why this arm might be more turned to see the palm of that hand is the lat here. He's got a bit more lat bulk, so that could be tight and pulling that arm round. So there's various things going on. As I climb up the body, we can see that right shoulder slightly elevated a bit more. So there could be a combination of tightness going on. That's lifting and pulling forward on that shoulder. So that's basically him looking from the back. Another indicator for this spine that's maybe got a slight little bit of scoliosis in it, where I'm saying it's bending from left to right, is you can see the crease here. All right, where there's not one on this side, but he's got a definite crease on this side. So that would indicate that he's turning slightly, hence we're getting that cup there. Okay, so that's what's going on from the back. Head's looking pretty neutral. Maybe he's just tipped slightly to the right a little bit, but it is marginal. Okay, so we're just going to have a little look at him from the side now. Here we are at the side now, kind of having a little look again from the foot up. So I'm going to run a straight line straight up. Yeah, so we're coming straight up. So straight away the knees are slightly forward, the hip joint is slightly forward. As I come up, the shoulder joint's slightly forward and the head is well and truly forward. Okay, so I should be able to run a string line from the back of his earlobe through the shoulder joint, down through the hip joint, down through the knee joint and down through the ankle joint. So I haven't got that. So he is pushing his weight forward. So he is leading at the front, but coming back with the shoulders a bit, because that's not too bad for alignment, but the hips are definitely forward. So again, chin's well forward. So we've got a little bit of chin poke coming on there, and we've maybe got the start here of a Dowger's lump, which nothing at the moment, but it could just be based on tightness here. But left untreated, that could well develop further. Not being rude or anything like that. Steve's obviously carrying a little bit of excess weight, so that shifts the centre of gravity forward, hence why he's probably leading more forward with the hips. So there is a strong possibility that he might have an anterior tilt, but in the same token, he could have tight hamstrings because he's quite leading with the hips forward, but the back coming back could indicate that there's a tight lower back and tight hamstring. So we need to do a test on that. So that's it from the front in a nutshell. From the side, I should say. The front would probably replicate what I'm seeing from the back, so I'm not really going to go there.
That whole thing with broomstick handle at gym, innit?
It is, yes. Right, so now what we're going to do is we're going to look at some range of motion tests. Postural assessment's done, range of motion. So Steve, keeping your hands on your thighs for me, can you flex forward, bend forward at the waist as far as you can go? Is that painful now?
It's tight.
It's tight. Does it generate pain?
It's hurting a bit.
Yeah, okay. And then come back up for me. So this time I want you to turn side. Well, I'm coming to the side and I want you to flex backwards now.
So that way, yeah?
Yeah. Does that generate any pain as you do that?
Tight again.
Tight.
A bit of pain at bottom.
Bottom of the back?
Yeah.
Yeah, okay. And then come back up for me. So this time I want you to imagine you're in between two panes of glass. Okay? Hands on your side of your legs and I want you to flex to your right. As far as you can. Is that as far as you can go?
Yeah.
Does that elicit pain at all as you do that?
Yeah, it's the same sort of tight pain.
Tight pain. So you're feeling like the muscles being stretched out. Yeah, okay. And then do the same to the other side. Oh, that's short.
Yeah, it is.
Much shorter. Okay. So is most of your pain on the right hand side of your back?
It's compression pain. It's like compression there and stretching there, but it's the same. It's like that belt of.
Yeah, but you know when you said you were getting pain that emanated down the butt into that's on the right side. Yeah, that's good because that's the fact that you're going short on that side would give us the indication that the pain's related to that side. So the next one, if you put your arms up into this sort of position for me, and all I want you to do is try and keep the pelvis as straight as you can, and then turn to face that way. Does that elicit pain, or is it just tight again?
It's just tight.
Tight, and then come back the other way.
That's a bit more painful.
Bit more painful as you're doing that because that's again compressing on that right hand side. Okay, so what we're going to do now is we're going to go into some special tests. All right, I'm going to start off with the slump test that I said I would have done earlier. Okay, right, so now we're going to do a Trundlenberg test. So all I want you to do, Steve, is stand on your left leg and I want you to raise your right knee up in front of you and hold that for us. And that's great. Pelvis is perfectly aligned, so there's no weakness of the gluteus medius on the right side. So can you do that again on the left side for me? And that's holding nicely as well. Fantastic. So now we're going to move to a Thomas test. Right, so if you want to get onto the bed, as I've just shown you, Steve. Sit and roll. Yeah, right off the bed. So the bony bits of your bum are right off the edge. And then let that go down. So this is now looking quite great. It's definitely negative because as I look in here at this, hip joint, hip joint, knee is below hip joint. So that's a negative. If you've got tight hip flexors, this knee would be up, running in that motion, but it's not. So we can let that just hang. And from a quad perspective, it's not too bad because this is hanging pretty much straight down. If I look at it from the front, it is kicking out a little bit, so you might have a slightly tight IT band. So Steve, if you want to just bring that leg up and then let the other one come down, exactly the same for me. Let that totally relax for me. So have we looked at it? So it's definitely negative on his hip flexors. So it's looking more and more like potentially a tight hamstring, tight lower back, hence he's leading with the hips forward. Okay, and then you can bring that leg up. And what we're going to do now is we're going to do a different test. Right, so what we're going to do now is we're going to have a look at a hamstring stroke lower back test for tightness. Okay, so Steve, can you put your legs straight or is that it?
That's as straight as they go.
Okay, so that's a good indicator that those hamstrings are tight. So all I want you to do is try and reach down towards your toes for me. And as I look at that back, we can see all the curve is coming from the upper back and very little. I mean, it's not as bad as it could be because his lower back, although it's vertical, some people's it actually goes back over. So he has got tightness in his lower back, but he's also got a lot of tightness in his hamstrings. So what we're going to do now, Steve, is I want to do a glute firing pattern test on you. So this is a glute firing pattern test. Okay, so all I'm going to do is I'm going to put a finger into the erector spinae muscles here, my thumb into his glute maximus, and a finger into his hamstring. And what he's going to do is try and raise this leg off the bed. So if you raise for me, Steve, and back down, totally relax, fantastic, and raise again, fantastic. So what I've got on here is a positive,
So his hamstring is firing first, then his glute, then his lower back. It should be the glute, hamstring, lower back. So his glute isn't working as it should. He's not producing the force from here. This is producing the force. Hence why he's so tight in the hamstrings. So a strengthening exercise you need to do at home, Steve. Okay, this is the easy one to start with. So we bring that leg to there, okay, and technically you just hold it there. So everything's relaxed, totally relaxed. And what I want you to imagine is you're trying to stop yourself going to the toilet. Or imagine you've got a £1 coin in between your butt cheeks and you're nipping it together to hold. Yeah, straight away that glute engaged now. Okay. So from there, now raise that knee just off the bed, hold, 2, 3, 4 and down. Relax, keeping that leg there. So then you'd nip again, and then you'd raise the knee up, hold, 2, 3, 4, and down. Okay? So that's how we'd go about initially starting to treat this. So what we're doing is, we're trying to develop the neural input back to this glute. Okay. Alright, we're trying to make it think, when it fires, that has to fire first before that. That's the idea of it. Right. And then once you've mastered this and been doing this, so I'd get you doing this twice a day if I could. Once you've mastered this for a few weeks.
Both sides?
Yeah, both sides, because I'm going to check the other side, but once you've mastered it, then we progress on to a slightly harder one, because we've got to get the neural pathway to this glute firing perfect. So we'll quickly test the other one just to make sure. So same again, so if you can raise that leg for me. Yeah, and back down, relax, and raise again. Yeah, so you're still on this one, but not as bad as that side, to be fair. It's still weak, but it is kicking in a lot quicker just after that, where that one was struggling to kick in a little bit. So it's part of some of your back pain. So I'm just going to feel you now, Steve. I'm going to do it from the other side so camera can see what I'm doing in that. Just going to have a little feel at you now, what's tight and that. So we know your back's tight, and I can feel that's like a rock. Yeah, but one of the things that compensates, we did a test for your glutes medius, and it was holding your pelvis stable. So I'm now thinking that this is working overtime, and as I go into that, that's quite tight. And you feel that?
Yeah.
Yeah. Painful when I press into it?
Uncomfortable.
Yeah. So we tight there. So this is me doing a bit of palpating. He's just jumped there. So a bit of tightness in there. I'm going to go into your Piriformis now. So what we do is we find that greater trochanter, and from the greater trochanter, generally if I come in from that to about 2-3 inches away from the butt line, that will be where my Piriformis is. So an inch up from it, I'll have my Piriformis running there. So from there, if I'm just going to feel into that now, Steve. Oh, is that bad?
That's not pleasant.
It's not pleasant. Right, okay. So we've got tightness in his Piriformis, tightness in his glutes medius. We know the glutes max is weak, so that's strengthening work to be done. We know his erector spinae is tight. Yeah. I'm just trying to go through his erector spinae now to his Quadratus Lumborum. Oh, that's like a rock as well. Yeah, so they're really tight. Coming down, up, yeah, hamstrings are tight. Sounds a pound. I know his IT bands are tight, because if his tensor fascial lat is tight, that feeds into it. Tensor fascial lat goes to greater trochanter, which then ties into the IT band. And I would possibly, I'm just going to check, yeah, tensor fascial lat, that's not too bad actually, it's just ticklish. Right. So,
you're a bad man.
I know. Bob that down. So, treatment wise now, we know we've issues going on upper body, so I'm not going to necessarily treat that this time, because I'm going to concentrate on his back issue, his lower back issue. They might well be attributing to it, but my initial phase is to treat here. Then I might do that on a second session with him. So we're going to treat his hamstrings, we're going to treat Piniformis, glutes medius, erector spinae, QL muscles for this, and finishing off with those IT bands. Okay, so that's our protocol today, what we're going to do. So without further ado, we're going to get straight into it. So what I'm going to do is introduce you to something that I like to use. So this is basically a sander. Alright, obviously it's not got sandpaper on, it's got a nice cloth on it, but what the sander does, it's all about saving your hands, you see, as much as you possibly can. So what the sander does is it properly warms the tissues up and it penetrates deep. That vibration motion really gets into the muscle and it's quite relaxing in itself. It's quite noisy though, so we're going to kick off. I'm going to do this side because I'm going to work his right side first. Sanding done. I'll introduce you to my next piece of kit. So this is the Maxi Thumper Pro. What it is, big 8 balls banging into the muscle, tenderising it. Imagine he's a bit of steak, it's proper tenderising them up now. You alright, Steve?
Fine, mate.
Great
I'm
stuff.
like a darling.
Yeah, so I'm working it over his erector spinae, Quadratus Lumborum area, out into those Glutes Medius. What I generally find with people, certainly presenting as Steve's presenting, if those Glutes Medius are tight, they're the big instigator of a lot of the back pain because of how they pull, they shift the pelvis. Now one thing I could have done, I could have checked what his pelvis alignment was doing. Seeing whether he had an anterior tilt, posterior tilt, whatever. But it was quite clear from the visuals we were seeing on him that he's leading with the hips through tightness in his lower back and his hamstrings. So more than likely he's got a posterior tilt on his pelvis. Hip flexors were lovely. That Thomas test indicated that they've got loads of range of motion in them. Especially considering his hamstrings are tight. Okay. Just tenderised him a bit there. So we'll get a bit of lotion on now. I'm just going to start off with a little bit deep lateralising to this erector spinae, Quadratus Lumborum. Now what I tend to do is I work down and come back, purely because as you loosen other areas down, these areas tend to loosen down further still. Now obviously everything we do, we work on that pain threshold. So 10 is excruciating, 1 is can't feel anything. The magic number is 7, so anything above 7, we need to ease back to that magic number. So just a little bit of finger kneading in there. You could do the old two-hand kneading and things like that, but I tend to find my sander and my thumper takes away the need for that. So at the minute I've got a bit of a deep tissue thumb sweep going down that erector spinae and into that Quadratus Lumborum to the top of the hip. Now I'm coming into that Glute Medius, just a little bit of finger kneading into it. So I'm pressing into it and then dragging back on it. Okay, so from there, just going to bring a little bit of an elbow in, a little bit more force into that now, and it's already starting to slacken down. Deep thumb going in again, so it's my thumb on with my hand on top, driving it in. That's it. Nice stuff. Right. Come round now. So from there, nice elbow sweep down now. Come through. And now, let's get my therapist's thumb on. And this is now really getting deep into that. I can really feel the tightness there. So what I'm going to do there is I'm going to just give it some friction into there. How does that feel, Steve?
It's alright.
Uncomfortable?
Very.
That's it. I'm going to come back to that. So again, some deep thumb sweeps, bit of deep tissue work there. What I'm going to do is come back to that in a bit. I'm going to go into Piriformis now. So now, nice fist. I'm going to do a little bit, just relax as much as you can, Steve. If the client's tensing up, it's not good for us. So all I'm doing now is a bit of fist kneading into his glute max to get through that to that Piriformis. So all I'm doing is driving in and twisting on it, driving in and twisting on it. That's it. A little bit of specific thumb kneading now into it. Again, just try and relax as much as you can, Steve. Nice slow deep breathing. That's it. And from there, you get a little bit of an elbow into that. Ooh, he's feeling that one. Scale of 1 to 10?
No, 5.
5, that's alright then.
It's just the initial shock in it.
Yeah. So we're just trying to get through that glute max into that piriformis, and I'm running with the line of the muscle now. I'm basically frictioning it with my elbow now, and I can already start to feel it getting easier to do. So I'm going to come back to that one. So from there, I'm going to do a bit of work on the hamstring now. Bit of effleurage on it to start with. Then some little bit of single hand knead, palmar knead going on. Oh, I feel that IT band as well as I'm running up it. Coming to that in a minute. We'll go to double hand palmar knead now. And then we'll take that to some little bit of ringing. So now some nice deep thumb rolls, and what we're trying to do now is go up each of the muscles. Okay? So what I'm going to do is just bring that camera down a little bit so you can see it. See exactly what I'm doing. So I'm thumb rolling up each individual. So I'm going up his bicep femoris at the minute, all the way up to where it joins the ischial tuberosity, and then all the way up to roughly coming onto the outside of the leg. Can't see, might see a bit better there when I'm coming on the outside of the leg towards that greater canter. That's it. So I'm actually splitting my thumbs now. One's going one way, one's going the other. That's it. Again, nice bit of one up his semitendinosus now. Thumb rolls all the way up to that greater canter, to the ischial tuberosity, sorry, and now all the way up onto the semimembranosus, all the way up to that ischial tuberosity. Great stuff. Edge of the hand now, sweep up it. Just having a feel. He's got a few little trigger points there. So I'm just going to bring in another tool. This is a tool that I've made. I like to call it the Dominator because I don't care who you are. It works on you. So I've got two ends and I've got the thin end now because we've got a few little trigger points going on here. So I'm just going to put some direct pressure on that. How's that feel, Steve? Scale of 1 to 10?
5.
5? Okay. Just tell me when it starts to ease away.
Yeah, that's feeling better actually.
Yeah?
I feel that dropping off, yeah.
Great stuff. Little feel like that, yeah. We'll come up a bit more. Another one here. Does that one feel like?
Oh, that's painful.
Painful, scale of 1 to 10?
Yeah, 6, 7.
Okay, so this is a bit more of an active one then, because the pain threshold's a bit higher, so it's a 6, 7. And tell me when it eases off, Steve?
Yeah, that's gone.
That's gone. So we're going to increase that one. What are we at now?
We're back up to 6 or 7.
Great stuff. So we're just going to hold that on. Again, you can do this with your thumbs, but it's a lot easier with a tool. Easing away?
Yeah.
Sounds about. Have a little feel like that now. There's various ways of doing trigger point therapy. Because you can press on for 5 seconds, come off for 2 seconds, press on for 5 seconds, come off for 2. The version I'm using there is once the pain threshold goes down. Just try this one. That's it. So when the pain threshold drops, we apply direct pressure again, a bit more. It's a bit like doing acupuncture. Easing away, Steve?
Yeah.
Yeah, so we're going to increase this one up a little bit more. I can see the reaction because the body jerks. Easing away yet?
Yeah.
Lovely. Have a little feel like that. A little bit tight there still. Yeah, body reaction's telling me I'm on the money. Easing away yet, Steve?
Yeah.
Sound. A little bit more pressure then. Is that light now?
That's fine, isn't it?
Lovely. Okay, so that's feeling better already. Quite a good one there on his semitendinosus. That was on his bicep femoris there. Is that one like, Steve?
Yeah, that's unpleasant.
That scale of 1 to 10?
Say we get 6, 7.
Magic. Easing away. Going to increase that up a bit. You can hear the verbal there. Ooh. So I know I'm on the money. Easing away.
Getting there, yeah. Yeah, that's alright.
Yeah. Lovely. Have a feel like that. I can feel it. It's easing out. I'm just having a little feel a little bit higher up now. And that feels quite a goodish one there. That's pretty much right up at the butt crease line. Oh yeah, we've got a good reaction to that one.
It's not a good reaction.
Not from your perspective, but from mine it is. How's that feeling now?
That's alright.
Yeah, so I'm going to increase that one up a little bit, Steve. How's that now?
Yeah, that's alright.
Yeah? Great stuff. Like that, now a little run up it. You can feel the actual little sarcomeres popping as well as I'm going up deep with that thumb there. Yeah, lovely. And just come up this semi-membranosus. There, got a nice little one there as well. Is that one like Steve?
That's actually not bad at the minute.
Yeah. Okay.
A little bit of pain when you first hit it, but
He subsided straight away. Yeah. And then a little bit of shear just to finish it off. And then from there, what I'm going to do, I'm going to get my version of a thorough gun. Just going to run it up these muscles. Nice and slow pace. I'm not putting much pressure on this at all. It's just really the weight of the gun on this. So a great piece of kit this, thorough gun. Although mine's called a Rover. Thorough guns are very expensive. So we're looking at around £500 for a thorough gun. This was like 100 and, I think it was £110 or something. It was exactly the same thing. Taking that all the way up to that ischial tuberosity. And then up that semimembranosus. Then from there we're just going to run it up the IT band. Obviously a little bit uncomfortable. All I've got on is the flat end on this. Well, there's different attachments you can put onto it. Alright, it's feeling that one. Feeling that one a little bit. So,
it's much painful, just really uncomfortable.
So from there, I'm just going to do a little bit of thumb kneading on it. Cheers, Steve. A little bit of thumb knead. And the other way you can do it is a finger knead. So you can just get them fingers into it like that and then rolling those fingers. Got quite a bit of pressure on there. Okay. From there now we're going to have a feel. I'll use the bigger end on this one though, because it can be a little bit painful on here. So I've got a little one here. Just trying to nail it exactly. Is that on like Steve?
That one's not so bad. I should go up ever so slightly. I think you dropped below it a little bit.
Right, I'll get there. There we go. Scale of 1 to 10?
6, 7.
Okay. So obviously your IT band is just a fascia sheet. That's literally brings support, stability to the outside of the leg, but it sits over the top of your vastus lateralis, and when it's tight it puts a lot of pressure on that. Just a little one there. obviously we've got to be careful because this sort of treatment can cause bruising. Usually, especially on the IT band, we tend to get some like fingernail sized bruising, but I've specifically used the bigger head of my Dominator to try and limit that down. Another one there. Hopefully the camera's picking up that body reaction as I touch onto those trigger points. So they're just little segments within the contractile elements of your muscle fibre that have stayed shut and have become hyper irritable. One there. This will respond well at the end of the session when I stretch it out. It's a painful one.
Yeah.
Scale of 1 to 10, Steve.
By the time you've asked me, it's dropped.
Brilliant. That's okay.
It's that initial hit.
Yeah.
Yes, yeah.
Okay. So that's all I'm going to do really on that IT band. And that hamstring, just nice edge of the hand, on the hand sweep, up that hamstring and that IT band at the same time. Fantastic. Right, now we're going to move back up to the glute region, so piriformis in particular. So by loosening all this down, it's taken some of the pressure off around this area here. So now I can get back into a bit of fist compression on the piriformis. Some thumb needs going back onto there. How's your knees doing these days, Steve? Because we're going to do a piniformis stretch on here in a minute.
It's still not best.
Okay, so we'll try and work to your knee capability. If there's any pain, just let me know straight away and I'll try and adapt what I'm doing. Okay, so piriformis, we need that greater canter. Got it there. Generally come up about 3 inches from the butt crease, go an inch up, and that's where your piriformis is running. So what I'm going to do now is what we call an STR. So I'm going to create false insertion points. So from there, I'm going to put a fist in, I'm going to bring this leg up, I'm going to play the bandit now, see if any money comes out. So from there I'm going to push that piriformis away and I'm going to bend this leg out like that. So we've now got a stretch going on that piriformis. Feel that stretching, Steve?
Yeah.
Yeah. And then ease that off. I'm going to drop a little bit lower down, create another false insertion there, push it away, pull it, come down, and come further. Great stuff. Put that knee down. Okay, we'll back up now to this glutes medius. Now proper, getting that thumb into that now. And I'm stripping, so using the point of my thumb, stripping it right through that glutes medius now. That's great. Still a bit tender for him. Not as bad as it was though, is it?
No.
Because I've got a lot of force going through there now. So I'm quite pleased with that. Back to this erector spinae and QL. Now what I'm going to do now is I'm just going to banana you, Steve. So if you stay lying as you are, we'll take him by the knee, hold his hip here, and I'm just going to extend him like that. So I've fetched that QL nice and taut now. It's in a nice taut position. So I can really get into it now. Try and loosen it off. That's it. It's great, is that now? Feeling it. So Steve. Okay. That's it. So a little bit of an elbow sweep up that now. Because obviously that erector spine, sweeping out like that before it comes up. So we're trying to get it off. But that is already starting to soften down nicely. A little bit of stretching on the end on that and it'll be jobs are good. So I'm going to straighten your back up, Steve. Yeah, so reasonably happy with that. Proper into that, good and proper. Now what I'm going to do now, there's a few different ways of doing a connective tissue massage, so I'm going to stretch out the connective tissue here. So I'm going to use my forearms to do this, but I'm going to pin his pelvis with one elbow, so that one's pinning it, and with this one now, I'm going to put it on like that, and I'm really going to pull. Beautiful. Oh, lovely. That feels lovely to the touch now. You can see as I'm pushing up it, I can now get right into the muscle and it's creating that wave now. It's great stuff. Lovely. So what we're going to do now is work the other side now. Okay, so we'll spin this camera around. I'm going to let this do a bit of a shot from up above now. So, get the sander out again, get it nice and warm. Pointing up, make sure that your cloth's decent, because otherwise the Velcro might come through and rip them to pieces. And we get the old maxi thumper out as well, tenderise that bit of steak on the table. Obviously I know Steve, so I can have a little bit of banter with him. We've got to be careful what you say to some clients. Always try and remain professional.
I know you before you were professional.
Well, that's true. Clearly see those hamstrings are tight. The moment I put the thumper on them there, he reacted. So what we will finish off with these hamstrings is a bit of developmental stretching on them. I always finish with some stretching on the muscles that I've been working. We can release the pressure around joints not only will it ease all the pains, back pains and things like that, but we actually decrease the risk of osteoporosis, osteoarthritis, not osteoporosis. The joys of live recording.
It's not fast wind.
Yours, Steve?
No, you're alright.
That's the beauty of my videos. I just keep going regardless. I don't cut and stop and redo and things like that. I like to keep it all flowing naturally. So occasionally you do say the odd wrong thing, but as long as you can correct it pretty much straight away, it's not too bad. Okay, a bit of lotion on him now. Feeling alright, Steve?
Yeah, fine, mate.
So obviously the sander should have done its work, warmed the areas up good and proper, and like I say, it penetrates quite deep into the muscles. Thumper's then done a lot of the kneading work. We could knead if we wanted to, but there's no real need to now. They've done the work for me. So now I'm getting into that muscle. Okay. Rectus spine. Quadratus Lumborum. So basically I got my thumb on, my hand on to put a bit of force into it. I'll kind of leave the camera where it is, since you've seen a lot of the work done already from the side. Cutting through, right, so now some finger kneading into that Glutes Medius. Come round. That therapist thumb into there a little bit. You alright, Steve? It's nice and tight there, mate. Deep tissue stripping going on. Come back to that now. Get into this Piriformis. So a bit of fist compression, fist kneading onto it. And we'll go down to his hamstring. Try and relax as much as you can, Steve. Okay, so we're going to come to this hamstring now. So, a bit of effleurage on it. But as I'm doing the effleurage, I'm actually using more and more every sweep of me on the border of the hand up that tissue, so I'm trying to push it all out, lengthen it out, get a bit of a single hand palm and knee going. Look at that double hand. Bit of ringing. Right, bit of thumb rolls now. as I'm going up that semimembranosus. I can feel the little contractile elements popping as I'm going up them. I'm splitting them out, opening them up. All the way up to that ischial tuberosity. Okay, I'm going to do a little bit trigger pointing on here as well now. So that's fastest, not vastest, the semitendinosus is quite tight. I've got quite a few little trigger points in it, so we're just going to have a fairly quite active there. Bit of pressure. Scale of 1 to 10, Steve. What's that like?
5, 6.
You're jumping a bit more than a 5 or a 6.
It's alright. I'll tell you if it hurts too much, trust me.
Okie doke. Easing away?
Yeah.
Yeah. Another element we can do is just put a little bit of friction onto it then.
Pleasant.
A little feel like that one now. A bit better. What I'm really doing is, I know I'm going over a few little ones, but I'm trying to feel for the bigger ones, because if you get rid of the bigger ones, the ones that are really hyper irritable, we tend to loosen the other ones off as well. Good one there. Scale of 1 to 10, Steve.
6. That's dropping.
Dropping away. I'll put a little bit of friction on that one then.
Oh.
That's it. Scale of 1 to 10, Steve. 6 again. Seem to be applying just the right amount of pressure there then. Easing away.
Yeah, that's good.
Yeah, a bit of friction on there now then. And up this bicep femoris now. All going down there. Easing away.
Yeah, mate, yeah, that's fine. That one.
Okay. That ulnar hand, edge of the hand is great for squeezing all the tissues up. And then from there, get me rover. Alright. That semimedialis. Semimembranosus, sorry. Does help if you have a good night's kick before. All the way up to that ischial tuberosity. Semitendinosus. And then bicep femoris. then we're going to go up the IT band. Always feeling that one again.
It's not so much painful, it's just really uncomfortable.
Okay.
It's a strange sensation.
Yeah, I'm moving back a little bit. Okay, a bit of lotion on. So, thumb kneading up it. Don't actually feel. Oh, a little bit of tightness there. Trigger punch on there. That one like Steve?
That's fine, lovely.
That one right there.
Let's get in there.
Yeah. That one right.
That's fine.
I'm not going to friction it up.
Gully wiggly, yeah.
Right. Still a bit tender, but Rome's not built in a day. Put your thumb on that one, mate. What's that one like?
That's alright now. It's just that initial hit, isn't it?
Mm.
I'm glad that you
Bit
do
of
that.
Oh. Another one here. There we go. How's it feel?
That's still hurting a little bit though. Yeah, that's right now.
Alright now? Right,
Yeah.
we'll take this one up. Feel that one subsiding underneath us.
Yeah.
Great stuff. Right. From there we're back to the glute. We're going to work into this now. Get this piriformis loose. Bit of a thumb knead on it now. Just relax if you can, Steve. So from there, we're just going to stretch it out a little bit. We'll bring this leg up. Bit that piriformis. There we go. Pin it, push it, pull the leg back, pull the bandit. Down, same again. And back. Last but not least. Feel that stretching, Steve?
Yeah.
Okay, great stuff. That come down. Right, so we're going to go back to that Glutes Medius now. I'm going to tap it from the other side. Stripping through it now. Just there. What's that one like, Steve?
The first time you hit it, it was really painful. It's not so bad now. It's,
Ease the way.
yeah.
Right stuff. Just got a banana here this way, like that, so I can get into this QL a bit. I'm feeling that one a bit. Nice deep elbow up it. Hello. I've been called all the names under the sun, and then when they get off it's like, oh god, I feel so much better, thanks. Straighten your back up, like that. Okay, we'll pin that pelvis with this elbow. With this one, I'm going to do that connective tissue. Massage, so stretching out that connective tissue. Nice deep thumb up it. Right. Right. So what we're going to do now is some stretching. So Steve, what I want you to do is lie on the bed, on your side, facing this wall, not the door. I'll give you some pillars. You alright?
Yeah, fine.
I'm going to let the camera catch everything from this angle now. Okay. Right. So, if you shuffle to the edge of the bed for me, that's it, and then just keep this bottom leg bent.
Yep.
First thing we're going to do is stretch this IT band out, okay? So I'm just going to pin the greater trochanter and just above the knee. So I'll bring the leg out and then just above, push the greater trochanter away and push the knee down. You feel that one, Steve?
Absolutely.
Yeah, so we're stretching out the IT band. And I'm going to relax there. Just let me take the leg. Now we're going to perform an STR on the Glutes Medius. So I'm just getting into that. There we go, there's the bad boy there. And then from there, I'm just pinning down it, putting a finger on it because I want to put my elbow to that. So I'm pinning it, just let this leg come forward, Steve. I'm pinning it and I'm pushing the knee down now. Do you feel that stretch, Steve? Yeah. Great stuff, my knee's off, come up a little bit, pin it, push the knee down. Superb. Then from there we're just going to stretch out all the QL, the lower back, all the way down. So we're going to take that shoulder back, just let this leg come off, nice slow deep breathing, and this is just gravity taking effect. You should feel that stretching right across the lower back, right on the outside of the butt. That's it. So a nice big breath in, breathe out, and let it relax. Sound as a pound. Good stuff. From there, we're going to roll you to the other side now. So you'll get to see it all from this side. Okay. So, again, Steve, what I need you to do is shuffle to edge of bed for me. Okay, and then from there, let this leg come over. So again, hand on the great decanter, hand just above the knee, and then from there, I'm going to push the great decanter away and the knee down. Feel that, Steve?
Yeah.
Yeah, so we've got a nice stretch on that IT band. Right stuff. Lift that leg and take hold of it, finding that glute medius now. There we go, there we go, that's it. So I'm looking at it, elbow into there, to pin it, I'm creating a false insertion and then pushing that knee down. Feel that stretch, Steve?
Yeah.
I'm going to let that come up, I'm going to move up a little bit, pin it again and then push that knee down. And then let that come up. Keeping that there, shoulder back for me. Let this leg come over, nice big deep breaths in. And out. Let gravity take its effect, big breath in. And out. That's it, lovely. Okay, so from there I want you to lie on your back this time. So we're going to stretch, this is the second to last stretch we're going to do. And what we're going to do is we're going to stretch this hamstring out. So from there, keeping the leg, so we'll go straight. All I want you to do, keeping the leg straight, you lift the leg up as high as you can take it with the leg straight. And pretty much on a point of bind now. So that's where our starting point. So from there, Steve, just let it relax. Just let it relax. I'll let it come down a bit. Let it relax. On you down. Keep that leg nice and straight. Yeah? You feel that stretch there?
Yeah, that's putting pressure on the knee.
Is it? Sorry.
Yeah.
There you go.
That's better.
That's better. Do you feel the stretch on the hamstring?
Yeah.
Okay, just let that relax for me. Okay. So all I want you to do now, Steve, is contract your hamstring. So you're pushing your leg down towards the bed, but only about 10% power. That's it. Because your leg is far more powerful than my upper body. And everybody seems to think, whoa, payback time. I'll drive them into the floor. So keep that pressure on for me. Okay, so when I say take a big breath in, I want you to take a big breath in. As you breathe out, you raise your leg yourself, keeping it straight, okay? So take a big breath in, breathe out, and you raise your leg. Okay. Super. And relax. Just let it relax there. That's it. So as we can see, he's got extremely tight hamstrings. Okay, now push into me again, drive that leg to the floor again. And then, nice big breath in, breathe out, and you raise your leg again. Good. Relax.
Feeling that right down here now.
Yeah, all the way down that ischial tuberosity, the bony bit you sit on. So this is going to be the last move we're going to do on it. So from there, push down into me. So this is what we call a crack stretch. Contract, relax, agonist. Contract, relax, agonist, contract. It's a great form of METS, muscle energy technique, to help improve flexibility, range of motion. So nice big breath in, Steve. Breathe out. You take your foot up. You take it up. Lovely. I'm going to take it from there, turn you in and just move it across. Whoa, you feel that one?
Yeah, just a tad, yeah.
Just a tad. Eye water and tad. And rest. Okay, super. So what we're going to do is move the camera down to here this time to capture this one.
Capture every agonising grunt.
Yeah. Oops, let's position it right. Okay. Let's go and tip it that way a little bit. There we go. Okay. So, same again, Steve. If you raise this leg up for me, as high as you can take it, keeping it straight. So let it come back, nice and straight. Tell me when the stretch comes on. There. Okay. So, just now relax. Okay, now contract that hamstring, push into me, 10% power. So we're actively contracting now the muscle that we're trying to stretch, or going to stretch. Because once we release it and we make these hip flexors initiate the leg movement up, it creates a reciprocal inhibition on the nerve impulse back into this hamstring, thus taking the muscle spindle out of the equation to allow us to lengthen it. So, nice big breath in. Breathe out, you take the leg up. Superb. And relax. Press into me again. That's it. Just keep that on for me, Steve. Very well. I'm nearly finished. I feel like a new man after this. And take a nice big breath in. Breathe out. You raise your leg up. Wow, unbelievable.
I'll have a £10 dinner, Trev.
Well, no, you'll not be £10 dinner, no. That's
Worth a try.
Yeah, but you'd be like a bit like Stretch Armstrong. You'd be very pliable. And then push into me again. This is the last time we're going to do it on this one. Just one more stretching exercise I want to do on you. And then nice big breath in. Breathe out. Take that leg up. I'm just going to take that and put an internal rotation on it. Make sure we'll get that second head of your bicep femoris. And relax. Okay, how's them knees for kneeling down on them? Like if you were on the bed and sitting down on your knees?
I'm alright for a couple of minutes.
Okay, brilliant. Right, so what I'm going to do, Steve, I'm going to bring you up. Just sat onto the bed for me. Okay, so I'm going to take these pillars off. Let me just take this off. Slide that to there so it protects your feet. So what I want you to do, I want you to kneel on the bed with your feet off the bed here, so you're facing the telly for me. Alright? Okay, super. I'm going to bring the camera around here now so we can see what I'm doing.
Very exposed.
Yes, he's very exposed. Okay, so from there, can you sit back towards your feet for me? That's it. Lovely. Can you straighten up now? Right, what we're going to do is we're going to stretch these erector spinae out. Now we're going to do an STR on these now. Alright, now unfortunately for me to do this, because he's a big bloke, so it's hard for me to do it with just my thumbs, I'm going to have to use my elbow. So I'm going to hold his hip and I'm going to pin that erector spinae there. So all I want you to do now, Steve, is take your forehead down towards the bed and bend down, keep going. Keep bending, oh, as much as you can all the way down. Oh, that's
yourself.
it. Yep, that's it.
Right, okay.
Keep going, keep going, keep going, keep going, keep going, and come back up. Okay? We're going to do a little bit lower this time. Okay, you ready? And go. Go, go, go. Feel that stretching?
Yeah.
Keep going as much as you can. And back up. I'll do the same on the other side. Okay, you ready? And bend. Bend, keep bending as much as you can, and then come back up. Come a bit lower, and then bend, 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 and come back up. Superb. Right, so from there we're going to bring you off the bed. So all I want you to do is turn to face this way, okay, and then from there, can you now put your hands on your thighs, bend down as far as you can. So we've gone beyond where you were. How does that feel as you're bending down though?
I'm hit that tight.
Tighten the back
Just
of
there.
Yeah, tighten there, but not in the back or anything.
Not in the back now.
Pain wise,
Fine.
fine. Come back up. Superb. Just go down to your left side, because that's when you got the pain before. That's further than you went before. How does that feel?
There's no pain there.
No pain at
It's a little
all.
bit tight, but no pain.
Okay, we'll go down the other side. Okay, great stuff. So all in all, feel good?
Yep.
Yeah. So that is a good session as far as I'm
Cool.
concerned. Probably need a second one, but well, hey, fantastic. So then, guys, that's how I would treat somebody with his bad back. Obviously, we're getting a positive result there. It's feeling much better. Greater range of movement on it. So jobs are good.